Hey guys, Dr. Nickels here with another 2 cents, and I wanted to talk to you about probiotics. So I'm not a huge fan of probiotics, and I think it's just because of things that I've seen over the years. So one, I see a lot of patients that are taking a lot of probiotics, so they've been on probiotics for years. And I kind of am concerned about that because one, there are certain bacteria that can increase the production of histamine in GI, which if somebody has a histamine intolerance issue, that can cause problems. Two, we don't know that they have a flora imbalance in GI unless they were on antibiotics, or things that way. Three, a lot of people are taking probiotics, but their stomach acid is insufficient, or pancreatic enzymes are insufficient. So they're taking all these probiotics, and the probiotics are not going to stay because their GI environment is inhospitable. I also see people taking probiotics for years and then continuing to have gas, bloating, flatulence, even heartburn or acid reflux. And so this kind of brings me to the point of bringing up SIBO, which is small intestinal bacterial overgrowth. This is, it's a hot topic. It's been it's been a hot topic for years. And I don't do a lot of testing for SIBO, nor do I necessarily look to treat SIBO, because I feel like a lot of people that might be diagnosed with SIBO or have symptoms of SIBO, which could be bloating, gas, bowel changes, is because they're taking a lot of bacteria, probiotics, and it's causing an overgrowth of the bacteria. So I feel like people are creating their SIBO issue. So what we need to understand is SIBO, it's not an intestinal bacterial infection. Essentially, it's when you have too many benign bacteria living in the wrong neighborhood and intestine. So it's an intestinal overgrowth of bacteria. If people are taking a lot of probiotics, that's going to create the issue. Probiotics can cause a lot of the bloating because of the accumulation of the bacteria, but then can also cause brain fog, GI change. And this has been shown in different studies. This was a study out of the Medical College of Georgia that probiotic use can result in significant accumulation of bacteria in the small intestine, that's SIBO, that can result in brain fogginess as well as rapid significant belly bloating. And so at the end of the day, we look at probiotics as something necessary, which I understand. There's also beneficial yeast that, we don't know a lot about in a sense. We forget about that. And, unless you're on chronic antibiotics and things that way, I don't know that you need a probiotic. And a probiotic could actually be causing your problems. So, if you are having bloating, gas, brain fog and things and just generalized GI problems, and you're taking a probiotic, stop it and see what happens. So I'm a fan of if you want to increase GI flora, eat some dirt, because that's what our ancestors did. So at least in the interim, if you're taking a probiotic, stop it, see how you do, because you might actually be creating your issue. All right, guys, till next time, take care.